Caesar, can I get a boost?
I'm on a one-to-one.
Hi.
Hey, what are you doing?
Who are you?
Got this admission coming. Let me get ready. Okay, we should have. And we have nothing. Okay, what about here? And we have nothing. Where's Caesar? How come I have no supplies? I'm getting an admission.
I'm on a one-to-one. Hey, excuse me. You can get out of the bed. One second. Wait. Hold on, wait.
In the CCU, we wanted to look at how to reduce our one-to-ones on the floor. So we introduced the Zero One-to-One initiative. So we stopped floating our ICU techs off to the floor to cover breaks, and we stopped bringing in other people to cover our one-to-ones. And we covered it through our unit.
At the beginning, many of the nurses were upset and didn't understand the concept as to how we were going to manage our patients that were unsafe in the ICU without the one-to-ones.
The staff was surveyed and looked over this and agreed that this was the best way to manage our one-to-ones. It drastically reduces the stress of looking for coverage.
Any patients that are experiencing any suicidal or homicidal ideation should always have close observation by a nursing attendant or tech. What we have done in CCU is to 1. Constantly reassess the patient for the need of the one-to-one and work with the providers on the management of the patient. 2. Adequately staff the unit to make the patient one-to-one with a nurse. This way the nurse can concentrate on the care of this one patient. The nurse will sit outside the room to watch the patient, and coverage will be arranged by the charge or a tech for when medications or supplies are needed. This will allow for more resources by your support staff on the floor to help with the entire unit.
The next step we took was to look at our FTEs, or full-time equivalent hours, and how we could reduce that. So we looked at what other facilities were doing, and we were able to see that they would pair nurses one-to-one with a patient that was one-to-one, as opposed to overstaffing these patients' FTE hours. So in other words, instead of having a ICU tech and the nurse covering a patient for 24 hours, we were able to reduce our FTEs by having a nurse sit one-to-one with the patient, allowing our ICU techs to be on the floor, helping out other staff, stocking, and doing all the vital necessary things that we need on the unit.